Identification of all hazards, which can obviously vary according to the nature of the work which is being carried out.
Hi, welcome to the Careers Podcast. Today we're here with Dr. Mark Gauci from Occupational Health and Safety Authority. Can you give us a bit of an introduction about yourself?
Well, as you said, my name is Mark Gauci and I'm the Chief Executive Officer of the Occupational Health and Safety Authority in Malta. OHSA, as it is more commonly known, is the regulator in the field of occupational health and safety and is involved in ensuring that whoever has the responsibility to safeguard the occupational health and safety of workers does so. We can talk on different levels when it comes to health and safety. Health and safety during leisure activities, public health and safety. But here we are talking about a very important yet specific subject, and that is the health and safety of workers while they're performing work.
Okay. And what exactly is the role of the authority? So do you regulate health and safety on the workplace?
Yes. Apart from being the regulator in the field, OHSA has a number of functions which have been assigned to it by the law which establishes OHSA. These include the dissemination of information, raising awareness about health and safety, enforcing the legislation, investigating accidents as they occur, collating data, and so on and so forth. Another important role that OHSA plays is that it represents Malta, the interests of Malta, especially in international fora, including by being a member of the various statutory bodies that are set up under the EU treaty. These include the Senior Labour Inspectors Committee, the Advisory Committee for Safety and Health, as well as any other bodies which Malta needs to take part in. For example, the International Labour Organization, on matters that affect occupational health and safety.
Okay, and occupational hazards. So I think the first thing you would think of, for example, is a construction site. But is it related to all fields?
Yes, the law makes it amply clear that all workers, irrespective of the work which they are performing, need to be protected at work. Now, you mentioned construction activity. Correctly so, because construction is considered as one of the riskiest jobs and riskiest industrial sectors that one can be involved in. However, no work activity is excluded from being associated with particular hazards. Even office work, for example, is associated with a number of hazards and therefore risks to workers' health and safety. Examples which come to mind include musculoskeletal problems, which can arise because of bad postures, lifting, apart from the traditional risks to health and safety that one can think of, for example, slips, trips and falls. One must never ignore, for example, risks to the psychological aspects of health. When we talk about health, the first thing that comes to mind are the physical problems that can arise. For example, issues or medical conditions such as asthma, cancer, problems of the lower back, skin conditions, and so on. But another equally important part of health is the psychological aspect, and that is something that needs to be protected as well, because both the organization of work, the content of work, the workers' abilities, and whether that those abilities have been matched with the tasks that a worker is assigned, they can all contribute to the causation of issues such as stress, which is nowadays recognized also as the second commonest cause of problems at work, that can arise at work.
And the commonest is musculoskeletal?
The commonest are musculoskeletal disorders. Okay. There's a whole range of musculoskeletal disorders that can be caused by work, but they are mostly related to posture, lifting, pushing objects and carrying objects over a certain period of time, a certain distance. Those are, in a sense, the commonest causes of musculoskeletal problems. Another common disorder which can occur at place of work refers to those work activities which involve a certain degree of repetition, and therefore that is why they can cause repetitive strain injury, RSIs. These are caused by using the same joint, for example the wrist or the elbow, repeatedly and for a long period of time. And unfortunately, these conditions can lead to situations whereby the worker has to take time off, often for a very long period of time, because of the ensuing damage that is caused to the joint.
Okay. And whose duty is it mostly to safeguard the health of the employee? Is it of the employer or the employee themselves?
No. According to the legislation, the employer is always responsible to ensure the health and safety at all times of the work that is being carried out. There's also a principle which says that notwithstanding the obligations of workers in the field of health and safety, an employer shall always remain responsible for anything that can occur. People may find this strange, and you often hear arguments even being banded out in the media which say that the employees ignore their own health and safety by not making use of the personal protective equipment that has been provided by the employer. But there's a reason why it should be so, and why even when the workers refuse to make use of the PPE, the employer should remain ultimately responsible. The reason being that the law establishes what is called a hierarchy of control measures. So, which starts with, or rather, it gives importance to what is the most important, and so on. So, what would be the most important thing that an employer needs to do? And according to this hierarchy of measures, the employer is first obliged to remove or replace the hazardous with the non-hazardous. For example, if there's a noisy machine, then it is not enough for the employer to provide personal protective clothing and issue hearing or ear defenders. The employer is obliged to see whether a less noisy machine exists instead of issuing the PPE. And this needs to be followed by certain measures that differ in scope, but ultimately have the main objective of protecting the worker. For example, by including or introducing other technological measures. If the machine cannot be changed, then the employer is obliged to introduce other technical measures, for example, enclosure, noise deflectors, silencers, and so on and so forth, to make sure that the machine becomes less noisy. If that is not sufficient, then the employer is obliged to take administrative measures, for example, reducing the time that a worker is expected to spend close to or working with that machine. And therefore, the employer may consider introducing a rotation system whereby different workers are exposed but for shorter periods of time. And that is a time which does not lead to hearing losses. Following that, the employer also has the obligation to train the workers, inform them of the reasons why such measures are being implemented, and to ensure a system of supervision which would stop a worker from working in with a particular hazard, and thus make sure that the worker is protected at all times. So that is why it is not correct to say that the workers did not avail themselves of the PPE. one has to see, but has the employer taken all the measures according to the hierarchy of control measures before issuing the personal protective clothing or equipment? And this can be applied to all hazards and risks. Now, one has to keep in mind that the two terms, hazard and risk, do not mean the same thing. Often they are used interchangeably, but really they mean different things. A hazard is something which has the ability to cause harm. We are here inside, we are sitting on chairs, so there's the hazard that the chair may collapse under our own weight. But what is the risk of that happening?
Exactly.
And the risk is a feature of the probability of harm being caused. So one refers to this inherent characteristic to cause harm, while the other, risk, refers to the probability of harm actually occurring. And that is why one of the principal pillars upon which modern occupational health and safety are nowadays built, and that is the risk anticipation. So by carrying out what is called a risk assessment, which is the simplest tool that is available to employers by which workers can be safeguarded. Now, many people seem to think that risk assessment is something abstract, or it is something which is difficult or complex or even difficult to comprehend. Now, in reality, every time we try to cross a road, we perform a risk assessment without actually being told that it is called a risk assessment. But before you cross, the least that you can do is look one way, then look at the other, see whether cars are approaching, and make a conscious decision as to whether you should cross the road or not. That is the simplest form of risk assessment. And risk assessments should be performed. It is actually an obligation of an employer to carry out a risk assessment. And this exercise involves the identification of all hazards, which can obviously vary according to the nature of the work which is being carried out. A worker working in a construction activities is exposed to different hazards than is a worker handling chemicals, or working in the manufacturing industry, or even working in an office. But this identification of hazards should be followed by an evaluation of the risks, starting with the highest risks. For example, if one is working in the construction industry, the highest risk would be, for example, the risk of falling from unguarded edges, which, as an aside, is the largest cause of death in the construction industry. Falls from heights. And these falls from height occur because the hazard of the unprotected edge, the risk, having a worker working at the edge without adequate protection, has led to a high risk which remains unaddressed, and that is by providing edge protection, if need be, by providing harnesses, and so on and so forth. So that is one example of hazard and the risk in the construction industry. But even, for example, working or handling chemicals, there's a whole range of chemicals that can be encountered at places of work. All chemicals have the propensity to cause harm, but the degree of harm obviously depends on the nature of the chemical, as well as the length and type of exposure, as well as other factors. I'm trying to keep it simple, but even issues of how the chemical enters the body makes a difference. So if a chemical enters the body through skin contact, the worker needs to be provided with gloves, impermeable gloves, and so on. Obviously, taking into account that hierarchy of control measures to which I had referred earlier on. So if there's a chemical which is emitting fumes, for example, the obligation would be to try and control those fumes from exiting and contaminating the work environment. And so on and so forth until one decides to provide the workers with the personal protective clothing.
Okay. Obviously, recently, due to the pandemic, we have seen a shift in jobs. How do you think the pandemic, such as moving to online working, how do you think that has affected occupational health and safety?
That is a very important point to make, which is also relevant to the times, to the current times. COVID-19 is nowadays recognized as a potential occupational disease, and it can be caused, or rather it can become an occupational disease either if the work involves contact with outsiders, that is people who are not directly related to the workforce but include clients, for example, or visitors to premises and so on. But it can also be transmitted between the workers themselves. Now, COVID-19 is essentially considered as a public health concern. But that does not mean that the workplace and every employer should not take any measures at the place of work. And in fact, despite it being a public health concern and despite the legislation being considered as being issued under the Public Health Act, however, the employer is also obliged to take all those measures to safeguard the workers so that the risk of transmission, either from outsiders visiting the place of work or between workers, is reduced as much as possible. Now, there are various measures that can be taken. They have been mentioned and issued as regulations under the Public Health Act. But in many instances, these are not specific regulations, but rather recommendations being made under the Public Health Act. Insofar as the Occupational Health and Safety Authority Act is concerned, measures actually have to be taken. And if one were to apply this so-called hierarchy of control measures, you try to avoid the risk. And that is why when work can be carried out from home, the workers are assigned remote working. That is, that they do not have to come to the place of work, but can carry out their work from home. There are other measures that can be taken. For example, if the workers still have to come to work for whatever reason, essentially, but other measures would require to be taken. But these all relate to the maintenance of social distancing, that is keeping workers at least 2 meters from each other, but also from any client or person who visits the place of work, and also ensuring personal hygiene through the provision of hand sanitizers, making available soap and water at all times, and so on. There are many other measures that can be taken. For example, one thing would be to prohibit the use of the canteen, for example, and introducing staggered breaks so that workers do not all stop work at the same time and they all congregate in a restricted place all at the same time. Obviously, what is called respiratory hygiene needs to be safeguarded at all times, and that includes ensuring adequate ventilation. For example, OHSA has just issued a guidance document which refers to the ventilation requirements at places of work and air conditioning systems, because we have, over the months that COVID has been around, we have often received queries and requests for information regarding air conditioning systems. Are they safe when to be used? And OHSA lists the measures that can be taken to reduce the spread of COVID-19 even at the place of work.
Okay, and what would be an employee's rights if they feel that their health is not being safeguarded at the workplace? So, for example, we're seeing reports of employees saying their employer is notice that someone is positive and they're not telling them to quarantine, for example, they're telling them to go into work anyway. What are the rights of the employee?
There are two principal acts which regulate the subject. As I said before, COVID-19 is considered as a public health concern. And therefore, anything which has any regulation or recommendation made, either in terms of the Public Health Act or through the powers that the Superintendent of Public Health has, that immediately applies even to places of work. Now, for example, under the Public Health Act, the regulations have been issued with regard to the obligatory quarantine of workers who have come in contact or have tested positive at the place of work. So one always has the right of recourse to the public health authorities. Insofar as occupational health and safety is concerned, a person can also contact OHSA so that the case is investigated. In terms of the Health and Safety Authority Act, we do not have the power to invoke the requirements of the Public Health Act, but we have the powers to apply and enforce the various requirements and provisions of the Occupational Health and Safety Authority Act. So in terms of the OHSA Act, it would be sufficient for an employer to provide social distancing, for example, measures and physical distancing, the physical barriers between workers. And that would be enough in terms of the Health and Safety Authority Act. But then again, there would be the various provisions which may be different which have been issued under the Public Health Act. So on issues of quarantine, for example, one should check one's rights with the public health authorities. Insofar as measures to be taken at places of work, one can contact the Occupational Health and Safety Authority.
Okay. I'm going to move back to something that we mentioned because I find it quite interesting. When it comes to psychological support, what are the recommendations that one would give to employers to safeguard someone's mental health?
First of all, the Health and Safety Authority Act, or rather the scope of the Health and Safety Authority Act is to avoid situations which can give rise to risk. As I have tried to explain, to the various hierarchy of control measures and the various other measures that can be taken at the place of work. And it does not involve itself either with treatment or management of any ensuring problem. So the Health and Safety Authority Act cannot, or rather does not refer to the management of workers who find themselves ill or suffering from a disease which is caused by work, but rather the Health and Safety Authority is involved with regards to the prevention and protection of workers. Now, insofar as psychological health has been concerned, now one can also say that this is very much a subjective subject. What constitutes stress to one person may not be construed as being stressful to another worker. Secondly, stress is a defense mechanism, so stress in itself is not a disease or a disorder because it's a protective mechanism that has evolved over time with the primary intention of protecting a person who finds himself in a dangerous situation. So stress itself is not a problem, but it can become a problem if the person finds himself or herself not being able to cope with the situation that he or she finds himself or herself in. So to avoid these situations, OHSA, rather than issuing regulations because of the huge subjective element that is concerned, OHSA has drawn up what it calls a framework of action that can be taken with regards to stress at work, which is mostly involved with the prevention, the early identification, and the access to treatment. And this is something that is being, how should I say, promoted amongst the social partners, both the employers' organizations as well as the organizations representing the workers, to ensure that these provisions, these various provisions of this framework, find themselves in, for example, the collective agreements, which are signed between employers and the unions. And it would be a good thing to make reference in these collective agreements to this framework for the control of work-related stress.
Okay. And we've mentioned quite a few diseases now that are related to occupation. Can you run us through a bit? What are the most common ones?
The commoner two are musculoskeletal disorders, and followed by stress and other psychological conditions. But then it is said in the field of occupational medicine, now not in the field of occupational health and safety, that no organ system is free from medical conditions that can be caused by work. Obviously, the exposure needs to be there. But one can think of all spectra, or rather all the spectrum of disease that one way or another can be caused or has an association with work. Starting off with skin conditions, for example, there are many chemical agents which can affect the skin in different ways. Dermatitis, for example, is a very common disorder that is caused by exposure to particular chemicals. But then again, in Malta, because we are a Mediterranean country, there is always the risk of sun exposure. And therefore, any condition which can be caused by exposure to the sun, that is, workers who work outside in the sun, can be a problem. For example, melanoma, which is unfortunately remains a very serious skin tumor, which can be caused because the workers are not protected while they are carrying out work in the sun and being exposed to the sun. Apart from the skin, moving to another organ system, the respiratory system. Again, there are many conditions which can be caused by work, including asthma, brought about through various chemical and biological agents which can cause asthma. In the case of asthma, both asthma and as well as dermatitis, for example, the skin the problem which I mentioned before, they can either be caused by work if one encounters the right chemical agent, but they can also be made worse by the work that is being carried out, in the sense that a person develops childhood asthma, for example, or has a skin condition which precedes the commencement of work. And this can be made by various work factors that can be encountered at work. So one has to keep that in mind as well. There are many other conditions, respiratory conditions, obstructive airway disease, allergic reactions within the lung that can occur as a result of exposures at work. There are various other much more serious conditions, for example, cancer of the lung and asbestosis, as well as mesothelioma, which can be caused by exposure over a long period of time. Usually it requires heavy exposure to asbestos at the place of work. Moving on to yet another organ system, the neurological system, for example. Again, there are many chemicals which can be encountered at work and which can affect the neurological system. Even something which is extremely common and is found everywhere, not just at work, but also in our daily lives, for example. Solvents. Solvents are a very common chemical which are very commonly found at places of work, but they are also found elsewhere. Even, for example, if you have a pen and you try and you smell the ink that contains a certain amount of solvent which can affect the body. But again, there are so many conditions that can be caused depending on the nature of the work that is being carried out. Farming and agriculture, the pesticide use, which can lead to both acute pesticide poisoning as well as various other conditions like anemia and also other much more serious conditions. So, as I said, no organ system is free from being affected by work exposures, and basically the take-home message is that first of all, the need to be informed of the hazards and risks that can be encountered at work, and secondly, that whichever work that one is hoping to carry out or is actually carrying out can be associated with a huge array, a very wide range of medical problems. Fortunately, the major or practically all hazards and risks can be adequately controlled so that no problems result from the work that is being carried out, the exposures encountered at the place of work, and so on.
Okay. To close off, so the aim of our Careers Expo is to provide all students in university with an opportunity to find a job. So in all the different fields that university offers, what would be your advice to these students to make sure that their health is safeguarded in the workplace?
I can very quickly pass on two messages. First of all, as I said, whichever work they carry out can be associated with problems to health. And that is why it is important for them to inform themselves and keep abreast of any new developments in the field. But also, occupational health and safety is a very complex and wide-ranging subject. And there is a scope for work for many different professionals, be they medical doctors, be they architects, be they engineers, be they project supervisors, for example, for working in the construction industry, or project managers, again, working in the construction industry. So apart from the need to safeguard their own health and safety, irrespective of the work which they carry out, there is also scope for a lot of work in the field of occupational health and safety. And this can be a very satisfying job, that knowing that you are safeguarding the lives, essentially, of other workers can give a certain amount of satisfaction to the person involved. Again, irrespective of the work that he or she is carrying out.
Thank you very much, and thank you for joining us today, Dr. Gauci.
Thank you for the opportunity.
Thank you.